And good morning. I'm Dr. Ara Duke-Majan, CEO, founder of the Duke Spine Institute and Duke Joint Institute. It is July 25th, 2023. We're broadcasting spine surgery live to you all over Facebook, Twitter, LinkedIn, and YouTube. And as we do every week, we broadcast all of our spine surgeries live, unless the patient doesn't give us permission, in which case we don't. Today our patient is someone who actually had surgery last week. We were supposed to fix 2 thoracic disc herniations that were causing his thoracic pain and pain radiating around the right side. We were supposed to remove his generator, stimulator leads, and we're doing a Duke plasma rhizotomy at T9-T10, T11. However, we were doing the surgery without a tube down his throat, which, you know, puts him under total control of the anesthesiologist of the airway. And he didn't tolerate the sedation. So we had to bring him back this week and try again with general endotracheal anesthesia, knocking him out completely, and he's doing phenomenal this time. So we're very happy. It was the right choice to make. He just didn't tolerate sedation. So what we got done last week, we got his generator out, which you saw if you go back and look at last week, you'll see it sticking out here. We still have the wires up there. We got 1 Duke laser disc repair done at T9-10. We have another one to do at T8-9, and then we're going to do the DPRs. So bear with us. Feel free to ask questions if you'd like. You can see on the pictures there, you can go north a little bit, Jordan, as long as you're not hitting the arm boards or arms. We are almost at T8-9 disc. Perfect. So line that up nicely, and I think you're off on WAG just a smidge. You can see the needle, right, Henry? Jordan, show us the needle.
Yes, we can.
So can you see the white arrow? That's the needle I have in right now from the right side. I'm aiming for T8-9 disc. Show us the T8-9 disc. He has a herniated disc, degenerated disc at T8-9 that's causing back pain and pain radiating around his sides. Now he also has what's called DISH, diffuse idiopathic skeletal hyperostosis. Look at the front of his spine. You guys see those bone spurs there? The little bridging osteophytes. And he's probably got DISH, but he could also have, that's not bamboo spine, that's more DISH. Diffuse idiopathic skeletal hyperostosis. Again, we're not concerned with that because that's not something we're treating. We're just here to treat his pain from this disc herniation. Shot. Now last week we had the needle already in this disc space. And unfortunately, because he was moving around so much, not tolerating the anesthesia, I actually had to abort the second level and start over today. So we're here to try again. Shot. Now, with thoracic disc herniations, most doctors won't treat these, not for pain, because they're just very difficult to access surgically. Shot? All right, let's get an AP. I feel like I'm very close, probably still hitting the facet, but I'm about 1 millimeter away from being far enough lateral to get around the facet. Do we ever get our other fluoro fixed?
I think they have to replace a part, so I don't think I've had any yet.
Oh, I see. So, are you using the 1 fluoro now? All right, you can see the needle. You can see the disc space, and we need to be just a titch, about 1 millimeter more lateral. Before you go there, okay. Show us the spinal cord stimulator wires that are in the epidural space. You guys see those lines right there? That's literally running on top of his spinal cord. We're going to be getting that out later. All right, that's looking pretty good, but I think we're too medial, so I need to go a little bit more lateral. Shot. Shot. Still hitting his facet. Shot. May have to start just a little bit higher. Shot? Let's see. We nailed it last week. Shot? How's he doing? Stable?
Yes, sir.
Shot? There we go. Shot? There's literally, I hate to say it, but there's literally a 1 millimeter space to get through with the needle. I'm threading the needle, they say. The reason I say that is that the bones that are back here, yeah, it's perfect. Show us the T9 disc. Here's the T9 disc. Y'all see that? Show us the endotracheal tube. Nope, yes, there it is. You guys see that? That's the endotracheal tube. That line, and there's the end of it. That little ball there shows you where the end of it is. That's in the trachea, so he's on a ventilator. Show us the spinal cord stimulator wires. So some doctor put the stimulator in him to try to control his thoracic pain, and of course it doesn't work. Spinal cord stimulators, the only thing they work for is making surgeons, pain management doctors rich. And venture capital companies that buy up pain management companies make them rich. But they don't help patients. And I'm a big advocate against spinal cord stimulators. They've expanded the use of spinal cord stimulators over the years, and now they're putting them in everybody with an ache or pain. And it's wrong. It's unethical. They don't work. And I strongly recommend people avoid them. All right. We are literally at T9. I feel the disc. We're in. Okay? Beautiful. So let's do AP one more time. I want to just check my levels. We're going to count up from T12. Any questions from the audience?
No current questions.
All right, let's show the audience why does a degenerated or herniated disc, same thing, bulging disc, herniated disc, ruptured disc, protruded disc, all the same thing. Why does a herniated disc cause so much pain for patients? Let's show that video. All right.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. You see now why herniated discs cause so much pain. It's due to inflammation. It's nothing to do with the size of the herniation. It has to do with the amount of inflammation within the annular tear. Now that was discovered at Duke Spine Institute about 16 years ago, and we've been treating that source of inflammation for years now, successfully. Virtually every single patient we've done this surgery on has had their disc pain is gone. Let's get some num-num. All right, for those of you who have not seen this before, we're making a small incision here on below his scapula, and we're going in with a dilator, and I'm going to put some numbing medicine to the tissues because there's still some pain fibers down here around the fascia and around the periosteum, and some even in the muscle. Shot? That's where we are? Okay. So as I go down a little deeper, I'm going to inject a little more numbing medicine. Shot. Now you don't ever want to inject this numbing medicine in the spinal cord or around the spinal cord. You don't want to inject it around the nerve roots. It will numb them up and they'll get spinal anesthesia, which we don't want. Now, sometimes you want that, but we don't want that today. All right, shot. Beautiful. So you can see the dilator is heading towards the back of that disc. And you can see the narrowing of the foramen. Show them the narrowing of the foramen. There's like a bone spur there. Yeah, Jordan's got it. It's a little lower. It's right where we're heading. Yeah, that right there. See that dark area? That means there's bone right there. A lot of bone spur. And that's probably what's pinching his nerve, wrapping around his side, causing radiculitis. Shot? All right. Once again, this Duke Spine Institute is the birthplace of this technology, the transforaminal endoscopic thoracic Duke laser disc repair. It's not done anywhere else in the world yet that I know of. And right there is the bone spur. Pushing through. Now we're inside the disc itself. And that was pretty easy because he's got a big tear in the back of his disc where all the inflammation is happening. My job now is to go in there and we're going to clean up that tear with a laser. Let's show our audience how the Duke laser disc repair works. But before you do that, guys and gals, the whole surgery is done through this tube. Henry, you see this tube?
Yes, we do.
This is 7 millimeters wide. That's why the skin incision is only 7 millimeters. And because we're not cutting his tissues inside, we're not damaging anything, we're just spreading the fibers of the muscle and the fascia. We're not causing any internal damage to the patient. Because of that, there's no need for pain medication after surgery. These patients all take a Tylenol and that's it. Many of them take no pain medication. When you go and have open surgery, done with a spine surgeon like fusion or laminectomy, you're going to be on narcotic painkillers for months, if not years. That's because they damage the inside of your body so bad that there's inflammation for months and years, causing more pain for you, new pain. All right, let's show our video on how the Duke laser disc repair works. Good job, everybody.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Welcome back. Now you know how the Duke laser disc repair works. The Duke laser disc repair surgery that we're doing now is bloodless. You have only a few drops of blood the whole surgery. You get more bleeding when you have a tooth taken out. The whole surgery is done through a tiny tubular retractor, which you can see here, right? Henry, you see this tube?
Yes, we do.
Right here. We have some suction, a fluid adapter, and here's the beauty, the scope that we use, okay? Today it's a Richard Wolf scope. Someday it'll be a Duke spine scope. Anyway, the scope has a hole in the back called a port where we go in. It has irrigation, light, and a camera, so we can see what's going on at the bottom of this tube. Now we're going to go down this tube, and here we are inside the disc. We're inside the T8-9 disc. Remember, we fixed the T9-10 disc last week. We had to abort the T8-9 because the patient wouldn't tolerate his anesthesia. He kept trying to get off the table. We couldn't make him any deeper because he would stop breathing. So for safety reasons, we had to abort and we had to come back today. All right, do you have any questions, Henry?
Yes, we do. The first question comes from Mick on YouTube.
Hi, Mick or Nick?
Mick with an M.
Hi, Mick.
And they asked, so can the annular tears keep happening, and how can we fix the inflammation?
Yeah, Mick, so here's what happens. The Duke laser disc repair fixes the annular tear and the inflammation. Because you see the laser right here I'm using right now, it's cleaning up the tear. And what that means is it's removing the herniation stuck in the tear. That's keeping the tear from healing. And then you see all the orange stuff? I know it's a bit hazy, and I apologize. Is it, why is it hazy? It is a little bit hazy. Uh-huh. We're putting a little anti-fog. How does this work? You just like that?
Wipe it on there,
Go wipe it or leave it?
No, just leave it. Let's see what.
All right. So we're trying to get a little anti-fog going. Well, we'll just have to make do. But what I'm doing is a debridement of the tear. Once this is done, the tear will heal. The disc will heal itself. So I start the healing process by removing the offending agent causing the inflammation. All this herniated disc right here. Grabber. Once I remove this with the laser and the grabber, then the patient's disc will heal itself. It takes about a year to heal. But then there won't be any more herniations because the annular tear is healed. The reason why people keep getting pain when they have a herniated disc is because the annular tear never heals. It's not possible to heal itself. It's not possible because you have the herniation stuck inside the annular tear. It's like trying to close a door when your neighbor comes over and complains that you're playing your music too loud. You try to close the door on them, but they're standing inside the door, and you try to close the door, but it just hits them, and they don't move. That's what the herniation is like, sitting inside the tear. The tear wants to close, but it can't close because your herniation's there. So you got to get rid of the offending agent, and then the tear will heal. Get rid of your neighbor standing in your doorwell, and you can close your door. Same concept. These are all pieces of herniation, preventing the tear from healing. Remember, inflammation is a natural response of your body trying to heal something. So the pain that people have from a herniated disc is actually their body trying to get rid of the herniation. It's stuck in the tear. All right, pulling back. Look at all that scar tissue from chronic inflammation. So far, so good. Any other questions?
Yes, we have another question from James on YouTube.
Hi, James.
I believe they were asking the same thing. Does the tear heal or will always be open?
No, the tear will heal. Once we're done with the surgery, the body will literally start closing off this hole. When I'm done with these, typically the tear is about 3 millimeters. Right now, the tear is about 7 millimeters. When I'm done, it'll be 3 millimeters. Look at that, all that inflammation right there. There's no way the body has been trying to heal this. All this is scar tissue from years and years and years of trying to heal this tear. So scar tissue builds up because your body is attacking this area. If you think about what is scar tissue, it's like, okay, imagine the Russians go to Ukraine and they start attacking the city, right? They're shooting tank mortars. They're blowing things up. Rockets are coming in, gunfire. Literally, they're destroying everything in the city. All the buildings are being destroyed. So you get what's called rubble. Rubble. Anybody know what rubble is? It's all the broken bits of concrete and steel and stone that was used to make those buildings. Okay, this is the rubble. The scar tissue is the rubble, right? And like I said, his body is trying to heal this thing, but it can't. It's trying to clear out the rubble and rebuild, but it can't. You can't rebuild while there's still rubble, and you can't rebuild while there's still war. The war is the inflammation, the rubble is the scar tissue, and he wants to heal, but he can't because there's still a war going on. You can't rebuild a city while they're still being attacked and bombed and blown up. It's impossible. So that's what's happening in this disc. It is literally like a war. Your body's inflammatory system is your soldiers. It's your Army, your Navy, your Air Force, and your Marines all together attacking, because with a herniation, they're trying to get rid of it. It's like a foreign invader. Just showed up one day, and they saw it, and they're like, hey, wait a second. It's not supposed to be here. Let's get rid of it. Little did they know they were starting a war that could never end. Your inflammatory system. Now, in some people, the inflammation dies out, the war dies out, and then the disc can partially heal, but it never fully heals because they never cleared out the rubble. So, the Duke laser disc repair is like going in and stopping the war, number one, by getting rid of the inflammation source. You're stopping the war. Number two, clearing out the rubble. Then the rebuilding is what your body does afterwards. So we get the disc ready to be rebuilt by your body naturally with collagen. All right, let me get that thing right there. Great questions. You won't hear this and see this anywhere else in the world, by the way. We're performing the most advanced surgeries in the world at Duke Spine. And for those of you wondering, what about laminectomies? What about artificial discs? We stopped doing those pretty much years and years ago. We were doing those as well. And we were doing them all outpatient, way before anybody else was. But that's old technology. The problem is, your surgeons and doctors you're talking to where you live, they only have the old technology available. Now, they don't want to lose the sale because you are a sale to them, you the patients. They don't want to lose the sale, so they're going to tell you their technology is the best treatment available for you. Of course, it's a lie, and they're all lying to you. But it's so hard to believe, isn't it? Go and watch a movie called Invasion of the Body Snatchers. It's a great movie. Go watch it. Invasion of the Body Snatchers from the 1970s. It may even be the 60s, but probably the 70s. And you'll understand how everybody wants your body. They're going to plant a seed in you. That's the seed of metal.
It came out in 1978.
78. Terrifying. You want real horror? Watch that movie. The movies they make today are not horror. They're not even scary. You watch Invasion of the Body Snatchers, and you'll understand what fear is. All right, any other questions?
Yes.
We're just about done here.
We have a few more questions. This next one comes from James, once more on YouTube.
Yeah, before you ask, I just want to apologize. The view is not so great, but it's just, sorry, somehow how it is. Now, the good news is I know what I'm doing, so even though the view isn't perfect, I've done this. You know how many discs I've done laser surgery on now? We're almost at 1,700, and then the average is 2.5 discs per surgery. So that's almost 5,000 discs that I've done. Duke laser disc repair.
Can I wipe it one more time?
Huh?
Can I wipe it one more time?
Yeah, we're done. Yeah, we're done. You can, but I'll take the question. Yep, we're done.
Next question from James. On YouTube, they asked, after removing the herniated disc, in parentheses, nucleus pulposus,
Patient temperature okay?
will the body make more during the healing process?
Yeah, so the question is, Dr. Duke, after you do this Duke laser disc repair debridement, will the body make more disc afterwards as part of the healing? So the body will make more annulus fibrosis. It will not make more nucleus pulposus. You don't need the nucleus pulposus. You can take all your nucleus pulposus out of all your discs and you'll have 0 symptoms and 0 problem. We have lots of patients with no nucleus pulposus and they have no symptoms.
We have a few more questions.
Sure, I'll take all your questions.
This next one comes from
Well, let's just watch this real quick before you do a question.
No problem.
All right, so we're done. We're going to take this tube out of his thoracic spine. Remember, we come from the side. We're doing what's called transforaminal. We're going through a hole that's already there. If you're really interested, look up the neuroforamen. You'll see it's a hole on the side of the spine, in the side and the back. And there's a left and a right for every disc. And the doctor that figured this technique out, transforaminal, was Dr. Parvis Camden. You know, endoscopic transforaminal was Dr. Parvis Camden. Now, before him, it was Dr. Wiltsey who did a transforaminal open, where he drilled open the foramen from the back, removing the facet joint, opening the foramen and going transforaminal. But that's a destructive procedure, but that was the first one that was done. Then Dr. Parvis Camden in Pittsburgh, he's an Iranian orthopedic surgeon. Back in the late 80s, early 90s, he discovered a way to get to the disc by going from the side rather than through the back like everybody else. And so that's who led the transforaminal approach. He did it for the lumbar spine. Now, there's 4 parts to your spine. There's cervical, which is your neck, thoracic, which is where your ribs are, lumbar, which is down your lower back, and then sacral, which is really 5 fused bones. Very little happens in the sacral region. But Dr. Parvis Camden discovered the lumbar, lower back transforaminal approach. Okay? And he had a lot of complications. He had to pioneer all the tools and equipment, and at first he didn't do a very good job, to be honest. There were a lot of problems, a lot of complications. He taught a few surgeons, and one of those surgeons was my mentor. Actually, a couple of those surgeons were my mentor, but one of them, Dr. Anthony Young, was my biggest mentor. He trained with Camden. He brought the technology to Phoenix, Arizona, built his spine center called DISC, Desert Institute for Spinal DISC, Spine Center, Desert Institute for Spinal Center, or something like that. Anyway, he was one of my mentors that taught me the lumbar transforaminal. Of course, the cervical transdiscal approach I learned from the Koreans. Dr. Sang-Ho Lee, Dr. Gun Choi, they were the pioneers of cervical in Korea, South Korea, at Woodidol Hospital. And then for thoracic that we're doing today, I pioneered that technology. I was the first in the world to do endoscopic transforaminal thoracic. All right. I will take your questions, but give me a second. I've got to start focusing on what I'm doing here with my DPRs. Okay, just give me a second. Shot. All right, so let's regroup here. So we're doing 9, 10, 10, 11, right? So there's 12, right? 11, 10. So I need to be a little bit higher. Shot. Move north a little bit, yeah. So there's 12, 11, 10, 9. I need you to be a little bit higher. Move your fluoro higher. Shot. All right, so there's 9 there, right? There's 12, 11, 10, 9. And I'm a little below where I need to be, so I'm going to aim a little higher. Let's see if I can get it. Shot. That looks perfect. And I'm on bone right there. So that's the perfect spot. We're going to give a little numbing medicine. Show us where my target is. It's just above the needle. Right, a little bit higher, right there. Okay? See the transverse process? Yep. And then where it comes and meets the pedicle. Show us the pedicle. Circle it. That circle right there. Very good. So that's where the transverse process meets the pedicle. Really, that's our target. Okay? And what we're attacking here, for those of you who don't know, is we're attacking the medial branch of the dorsal ramus. So pain coming from facet joints, which are joints that get arthritis, that pain comes from arthritis in the joint. And it's transmitted, shot, 12, 11, 10, 9. It's transmitted to your brain, the pain signals are transmitted to your brain, shot, by nerves, little nerves, okay? And so what we're trying to do is go in and basically transect or ablate those nerves. There it is, perfect, 12, 11, 10, 9. So it's perfect spot. That should be it. So rather than using radio frequency ablation, which doesn't work and doesn't last, we use a new technology called Duke plasma rhizotomy, DPR. And the same technology we're using to cure knee pain, hip pain, and shoulder pain. Shot. Shot. Now this patient is from Chicago. Shot. Shot. I'm just a little higher than I want to be. Right there. Shot. Oh yeah, that's perfect. Show us the TP. TP stands for transverse process. Now look at the top edge, right where I'm at, and then where it connects to the pedicle. That's the perfect spot right there. Doesn't get any better. So this is called the DPR, or Duke plasma rhizotomy. And it's a technology we developed here at Duke Spine. It's only found here. It's actually patented, or going to be patented. It's patent pending. So we're going to be the only ones doing it in the world. And we've been doing it for over a year. And what we know so far is that it works for facet pain. So if you've ever done an RFA, radio frequency ablation, and it's helped you but it didn't last, this is the new technology that's going to replace RFA. Shot. All right, let's ask those questions.
This next question comes from Mick, once more on YouTube, and they ask, so how do we get to you? Does insurance cover this?
How do you get to me? Does insurance cover this? So, first of all, you get to me by coming to Florida. Florida is where we are. You're going to have to travel. It's worth it. Because these other surgeons are just going to make a dog's breakfast out of your spine. Okay? And they're going to profit the whole time. Procedure after procedure after procedure. Does insurance cover this? It depends on your insurance. That's a great question. Some insurances do, some insurances don't. So it really depends on your your insurance plan, if you have a good insurance plan or not. So that's a kind of an individual basis. But great question.
This next question comes from Glenn on YouTube,
Hi, Glenn.
and they ask, why is that this is the only place that uses this method?
Why are we the only place that uses the method? Because number one, we discovered it. Number two, it's very hard to do what we do. I know we make it look easy. 12, 11, so that's what we're doing right there, right? That's the last one. And the equipment and tools are very expensive. The doctor would have to spend about $20 million to set up a center to do this type of surgery. And they don't want to, they don't have the money, number one. So there's a steep learning curve, and doctors would have to learn how to do this. It's not taught to them in their training. Their training teaches them how to do fusions and metal, spinal cord stimulators. Basically surgeries that make them a lot of money, but are not good for patients. I was trained to do fusions as well, but I realized this less invasive procedure was better for patients. A fusion, your recovery is 3 months to 6 months. With the laser surgery, your recovery is 1 day. With a fusion, it's a 50-50 chance you'll have improvement in your back pain. With the laser surgery, it's 100% that you're going to have improvement. We've never had anybody who didn't get rid of their back pain. And it's 98% elimination of back pain. So fusion, 50-50 chance of your back pain improving. With Duke laser disc repair, it's virtually 100%. Is that my picture right there? With fusion, you have a high complication rate of at least 25% chance of some complication. If you're doing a cervical fusion in the neck, it's 50% chance of complication. So with fusions, with invasive surgery like laminectomy, microdiscectomy, if you get a laminectomy or microdiscectomy, you're going to be back again for another surgery. And then you're going to be back again for another surgery called a fusion. So if you get a laminectomy or microdiscectomy, you're going to be in pain the rest of your life until you have the Duke laser disc repair, because a laminectomy and microdiscectomy don't address the source of pain, which is the back of the disc and the annular tear. The Duke laser disc repair is the only surgery that does. All right, let's get the fluoro out. So number one, Duke laser disc repair, it's not being taught anywhere except here. And I'm not teaching surgeons right now, so there's no way for them to learn. Number two, the equipment and supplies you have to buy is around $20 million per center, which doctors, hospitals don't want to spend the money for. Number three, what I get paid for the Duke laser disc repair is about $1,000. What surgeons get paid for fusions is around $10,000. So they're making a lot more money doing fusions on you. Even with the laminectomy, they make more money. So basically it's money. Surgeons don't want to offer you a treatment that they make very little money on. That's the main reason. You know, the other stuff can be overcome. The training, the cost of buying all the supplies and stuff, all that can be overcome, you know, by a hospital investing or somebody investing the money. But the problem is that the surgeons won't make much money. All right. So we've taken out his generator already, and now I'm going back in where the spinal cord stimulator doctor put his spinal cord stimulator. We're going to go find it and try to remove it. You have a Wheatie?
Yes, sir.
Great questions, though. So the answer to your question is greed. Greed by industry that makes the implants needed for fusions and artificial discs. Greed by hospitals that make a lot of money, hundreds of thousands of dollars on your surgery to do invasive treatments, and greed by corporate America profiting off of your getting more invasive surgeries. It's all greed, greed, greed. The American way. All right, so you can see already there's a little anchor here where they anchored the leads that they stuck in his spine. Now, how much money do you think the doctors made for putting this stimulator in? I can tell you, about $45,000. The profit margins are very high. I need a 15 blade. Okay? So they're putting these things in left and right, patients, even though they don't work. And patients are believing that they should get this thing done. It's horrible. It's a scam. It's a huge scam happening right now. And it's all promoted by the companies. The company that made this piece of plastic, all right, it probably cost them no more than maybe $500 maximum to make this thing. And they're selling them. They're selling these to the hospitals for $25,000, $30,000 each. So the profit margins are massive. Okay, for the companies that make them, as well as. All right, there's one lead. You guys see that?
Yes,
We got one out. Okay, let's take a look. I'll clean it up. This is literally sitting in his spine. Up here, like this. You see that? This is literally, they've implanted it into his spine. And guess what this did for him? Nothing. Was it going to do anything? No. Could I predict to you it wasn't going to work? Yes. But why did people put it in? Greed. This made the doctor that put it in, I'm sure they made 15 grand profit. And of course they made probably $800 putting it in. So you're looking at about $15,000, $16,000 on average. Okay? Did it help the patient? No. But why did the patient do it? Because they're desperate. That's why. So there's one. Now remember, we cut this connected to the battery from last week. Go back and look at it. We already cut that last week. Okay? There's one. And now let's get the second one. You want to know what drives the spine industry today? Greed. None of these treatments are good for patients. None of them cure patients except for what we're doing at Duke Spine. All right. Here comes number 2. Show me. You guys see this, Henry?
Yes, we do.
Look at all the scar tissue that has built up around this thing. It's a shame. Cyborgs. This poor guy, all he wanted was pain relief for his thoracic pain, which we're giving him with our surgery. There's number 2. How do you guys like that, huh? So Henry, I want you to keep this video of the removal of the stimulator for our new website. We're going to show these stimulators and what they're like, okay? Get some better lighting on here.
Copy that.
Can you see this? People need to know the truth,
Yes, we can see it.
okay? This thing was inside his spine all the way up to here. Didn't help him, it just helped the surgeon, helped the hospital, and helped the company that manufactured it. We're pretty much done. Looking good. By the way, he came from Chicago to Duke Spine. Smart man. Found us. All right, let's irrigate.
Yeah, you want some banco?
Vanco, no.
Okay,
No.
no banco.
No. Where's the suckers? Hold on. Any questions? I'll answer them for you guys face to face.
Yes, we have about 6 or 7 questions.
I'll come answer them for you face to face. I'm just about done here. We're irrigating the wound now. We're putting some betadine to clean it up. You know, we didn't get any bacteria in there, but just in case, we always do an irrigation anyway. Let's clean this up. Let's go. Okay, that's good. All right, there we go. All clean and beautiful. This is called a hot knife, by the way, Bovie. That's how we stop the bleeding. Now I'm going to sew them up. I'm going to put in a subcuticular stitch. There's some fascia here. There's a nice strong stitch. This is resorbable. Okay, I invert it. It's upside down so that the tail of the suture goes down into the wound rather than up and poking out of the skin. Patients don't like seeing purple strings sticking up out of their wound. We call it an inverted suture. Pretty standard in the industry. Nothing unique to what I'm doing. It's just the right way to do it. You'd be surprised how few surgeons know the right way to operate. I was very fortunate. I went to the top neurosurgery training program in the world. I was one of the 2 residents selected my year. The other was from Harvard. How's blood pressure? All right. Yeah, Dr. Tolentino and I were the 2 residents chosen my year. I came from USC in Los Angeles. He came from Harvard. And we got the 2 top spots in the country for neurosurgery. Neurosurgery is a 7-year training program. So when you're selected for 7 years. And you're there for 7 years. So it's a huge commitment of your life to leave your home. He left his home in Boston. I left my home in California to come to Florida for 7 years and basically live out of a hospital every day. You're spending 110 hours a week. Where is my Raytech or something? You know, I need something. You know, you can't take it all away from me. And basically, you're living out of a hospital. They don't pay you very much money at all. You get $35,000 a year. And it's barely enough to pay for your home. You have to eat, you know, at a Wendy's in the hospital.
And then
And you have no social life for 7 years because there's no time. You're literally 110 hours a week in the hospital working, not sleeping, working. And some weeks I would do 120. That's 3 full-time jobs, folks, for 7 years. Of course, my last year was easier. You're chief when you're in your last year. They call it chief. And there's different kinds of chiefs. There's good chiefs and there's bad chiefs. I was a good chief. I was kind and generous to my coworkers. And there were a lot of bad chiefs before me that were abusive. It's all about the same thing. They want free time and they want you to do their work. So call it scudding. It's spelled S-C-U-T-T-I-N-G. You got the rest?
I got it.
Great job, everyone. Thanks so much. You all did wonderful. We accomplished all the goals. We got the stimulator out completely. Send that off to the pathology lab. We got the thoracic Duke laser disc repair to take care of his disc pain and thoracic radiculopathy on the right side. And we got done the DPR, Duke plasma rhizotomy for facet pain. I'll come and answer your questions face to face, okay? Why don't you show our audience one of our patients? Thanks. Good morning, I'm Dr. Duke Majan at the Duke Spine Institute here in Melbourne, Florida with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Duke laser disc repair. We performed that 12 hours ago. And here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day. And I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm 1/4" incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Duke laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are pain-free for the first time in many years.
Many years, many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Duke Majan, and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions. And that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All
life.
right, thank you.
I'm Dr. Duke Majan, and you just finished watching one of our patients who had the Duke laser disc repair done. And of course, pain is gone, which is what we expect. The nice thing about the Duke laser disc repair, folks, is that this surgery we do at Duke Spine and the Duke plasma rhizotomy, they are a permanent cure to the pain coming from specific regions in your spine. It turns out that Duke Spine Institute is the first in the world to discover what actually causes back pain and assign probabilities to the causes. The disc is really the source of back pain in 85% of patients, the primary source of back pain. The facet joints are about 10%, and that leaves 5% for other things. The other things are the SI joints and piriformis muscles, sometimes the coccyx, and of course we're talking about degenerative causes of back pain. We're not talking about fractures if you're in a high-speed motor vehicle accident or you fall off a building. The cause is obvious. You're having a fracture. If you have a cancer of your spine, metastatic cancer or primary bone tumor, then of course that's going to be the cause, right? So we're talking about people that don't have a diagnosis of cancer, trauma, or infection of their spine. And those people, by the way, represent about 95 to 97% of all spine problems are degenerative spine problems, which is exactly what we're talking about here. People with degenerative spine disease. This is arthritis of the spine, herniated disc, bulging disc, ruptured disc, degenerative disc, spondylitic disc, all those kind of degenerative things that are not tumor, infection, trauma. Well, that is what we're dealing with here at Duke Spine. And the most common cause is the disc. So, why do doctors do spinal cord stimulators? They do spinal cord stimulators for two reasons. Number one, they want the money. It's big money. Big, big, big time money. And it's easy work. So it's easy, big money. That is the easiest big money surgery any spine doctor can do, is a spinal cord stimulator. And they are racking them up these days. There's no regulation on it, and the government's not stopping it. The only way to stop it is for people to become educated that spinal cord stimulators are the wrong treatment for about 99% of the time they're being put in. Yes, I said that. So, what is the right treatment? The right treatment is identifying the exact cause of pain and fixing it. And it's doable. We do it all the time at Duke Spine. Why are other doctors not doing it? It's because they don't want to do it. You see, once they identify the cause of your pain, then and the treatment, they're going to have to send you to Duke Spine for treatment because they don't do the treatments. So it's really a system that's broken, that the treatments we're doing at Duke Spine Institute are literally the most advanced, best in the world, but they're not available everywhere. Other doctors don't know how to do them yet. And so they're offering you guys what they do, and what they do know how to do, what they're trained to do, what makes them money, okay? And there's this belief that when you have back pain or neck pain, you're just going to be living with it the rest of your life, and the best we can do is shots and pills and therapy and chiro, acupuncture, yoga. All of these things never fix the source of pain, all right? Because the source of pain is a joint that's painful. And sure, when you have a painful joint, like if I had a pain in my finger joint here, the more you move it, the more you do, the more it hurts, right? We all know that. You have a bad knee, you get active, your knee hurts. You have a bad hip, you get active, your hip hurts. You have a bad spine, you get active, your spine hurts, all right? So what do we need to do? We need to find the source and target it with the treatment that is curative. And that's what Duke Spine Institute does, but we're the only ones in the world doing it. And that's why we want to spread the word, so people understand this. Stimulators are for patients with arachnoiditis, pain, burning in their legs, or end-stage peripheral neuropathy. It is so rare to see anybody with those problems. That's what they were originally slated for. People with end-stage peripheral neuropathy, cancer pain, and arachnoiditis. Years ago when they came out, that's what they were used for. Now, because they make so much money for the people that manufacture them, remember, you're spending $300 to make it, you're selling it for $20,000, $30,000. So the profit margin is massive. And they're putting in millions of these things now. They're promoting them. And they got the doctors doing them because the doctors are getting basically a huge kickback for putting them in. Folks, stay away from this stuff. It's bad for you. It's bad, bad, bad. You could see this poor man suffering with pain. We literally cured his pain with the Duke laser disc repair and the Duke plasma rhizotomy. And we got out a stimulator. All right, well, Henry is telling me we've got a lot of questions, so let's start tackling them.
First question comes from James, once more on YouTube. He asked, I have full Canadian insurance. I have full Canadian insurance. Can I be referred to Duke Spine Institute by my family doctor?
Hey James, you have Canadian insurance. Can you be referred to Duke Spine by your family doctor? Absolutely. How much will your insurance pay? I don't know. That's the thing about insurance companies. They thrive on not paying bills. Whether it's homeowners insurance or car insurance or medical insurance, the way they make money is by not paying bills. Period. So, will they try to weasel out of paying your bill? Probably. Will they be successful? I don't know. But in the end, this is the best treatment for you. You're going to need to pony up and make a sacrifice. Come to Duke Spine and get it done. You won't be disappointed. We have a lot of Canadians that come here.
Next question comes from Beth on YouTube.
Hi Beth on YouTube, Dr. Duke here.
They ask, can I get the DPR without surgery or in place of the DLDR?
Yeah, Beth. Hi, Dr. Duke here. Thanks for asking. It's a great question. Can you get the DPR done without getting the DLDR? Of course you can. Folks, let me explain this again. The DLDR, Duke Laser Disc Repair, is to fix a problem with your disc that's causing pain. The Duke Plasma Rhizotomy is to fix a problem with your facet joints causing pain. If you do the Duke Plasma Rhizotomy on your facets, it'll take away facet pain. It will not take away disc pain. Duke Laser Disc Repair on your disc will fix disc pain but will not take away facet pain. These are two different treatments for two different problems. The disc pain is the most common by far. 85% of people with back pain have disc pain. They need the Duke Laser Disc Repair. So we can do the Duke Plasma Rhizotomy on you as long as you have facet pain. But if your pain is coming from a disc, then doing the Duke Plasma Rhizotomy will not work. So I'll do it, but I won't do it if I don't think it's ethical. So if you're having clear-cut disc pain and you want to do the DPR, I would discourage you from doing it. And I probably wouldn't do it because I don't think that's ethical. Now, if you have a medial branch block and you numb up the facet joint, it takes part of your pain away, 50%, whatever, then the DPR is reasonable to do because it will help you. But I don't believe in doing treatments that don't actually help people, even though they're less invasive. Yeah, that's one of our philosophies. We're different at Duke Spine. We don't just do treatments to make money. We do them because we know they're going to help people.
Next question comes from Mick once more on YouTube.
Hi, Mick.
They ask, how do we ask if it's covered? What are the magic words when we ask the insurance companies?
Yeah, how do you ask if it's covered? What are the magic words? There is no magic word, Mick. The insurance companies lie, they cheat, and they steal. So you're dealing with an organization that makes money by lying, cheating, and stealing people. Now you tell me, do you trust them and what they tell you? They have no way, even if they approve your surgery in writing, you'll look at the bottom of the approval. It's going to say, this approval is not a guarantee of payment. They'll put that line in there. You know how many doctors have been screwed over or hospitals screwed over and not paid by the insurance companies, even when they get a prior authorization? Countless. Literally millions of claims not paid. The problem with insurance companies is they're bad, bad, bad people. And they have one goal, and that is to take your money every month and not pay anything for medical care. All right? Now, if you have a little baby that's dying of cancer, and they say, we're not going to pay for medical care to that little baby, guess what happens? It's in the news. Everybody gets angry at the insurance companies. So they would never deny a little baby cancer treatment because it would blow up in their face. They'd be the most hated people in the world. But they would do it if they could get away with it, trust me. Now, will they deny your surgery on your spine afterwards? Sure, because you're not going to go to the media and say, I had back pain and I had surgery, and they wouldn't pay the bill. Everyone's going to be like, who cares? We don't care. But if it's a baby with cancer who doesn't get medical care, oh yeah, that'll be front page news. If it's you who didn't get your medical care for your back pain, no one cares. They bank on that, okay? They have very, very highly paid, well-trained psychologists working for them, looking at their policies and what they do. And they make sure that they're not in the bad public light, okay? But we are, at Duke Spine, we're about to take on the insurance companies and start suing them on behalf of our patients for the bills they didn't pay. So are there cases where the insurance won't pay? Absolutely. And we're fighting them. But are there cases where they have paid? Yes. About 10% of our claims are paid without any fuss or muss. The other 90% of commercial claims we have to fight. That's about where we are right now. But we are fighting them. So what's the magic word? There is no magic word. Okay? Your insurance company is not your friend. They want to take your money and not pay your claims. And they'll do it as long as they can get away with it. We're trying to hold them accountable, but we need your help to do that. In the end, here's the decision you need to make. Do I want to live with back pain? That's it. Do I want to live with back pain? So if your answer is yes, I don't mind living with back pain, then you don't need treatment at Duke Spine or anywhere. You just live with the pain. If your answer is, well, as long as I don't do any activities, I'm okay. All right. Do you want to live a life where you don't do any activities and you don't have much pain? The pain's manageable. If the answer is yes, then you don't need surgery. You don't need Duke laser disc repair. Duke laser disc repair is only for people who want to get rid of their back pain and want to live a full and active life. Those are the people we want to help. Those are the people who value what we offer. Anybody else who doesn't, you know, if you're like, well, it's $30,000, I don't know if I'm worth it, I'd rather just live in pain, or, hey, it's $30,000, I'd rather do what the insurance company wants, I'll do a laminectomy. Dr. Duke? So we're back on?
Yeah.
I apologize, but as a neurosurgeon, I have to take calls. It could be an emergency, somebody dying and they need my help. So I apologize. What I was getting at is if you're having pain that's affecting your quality of life, and only you can decide that, not us, and you want to eliminate your pain, and you want to do it the right way, do it with the Duke spine, do it with the Duke laser disc repair, Duke plasma rhizotomy. These are the least invasive, most successful, lowest chance of complications during surgery. It's basically a safe way to get rid of your pain permanently. Okay? That's what we offer. So if you are somebody who your money is more important to you, go get your insurance company to give you a surgery, you're going to get butchered. And you're going to be getting stimulators and epidural shots and medial branch block and RFAs for the rest of your life. And we have these patients, by the way. They come here. Just look at our testimonials. I had 30 years of back pain. I was in pain management for 30 years. I had 40 years of back pain. I've been in pain management for 40 years. I've had fusions. I've had laminectomies. I've had discectomies. All right? Those treatments are not good. You know? These people are still alive, but think about the ones that never made it. Right? For whatever reason. Maybe they had a complication, infection, nerve damage, spinal fluid leak. They died. They committed suicide. There's a lot of people along the way with chronic back pain that don't make it to 40 years. But if you do make it to 40 years, think about you would have spent $250,000 of your own money in 40 years. And your insurance company will spend over $1 million treating your back pain for 40 years. So, doesn't it make sense to invest a little bit of money now, get it done, bill your insurance, we'll bill them for you, let's fight them together and get them to do what's right and pay for your surgery. Next question.
Next question comes from Suzanne on YouTube asking, can you repair damage other doctors have done during multiple back surgeries?
Susan's asking, can I repair damage other doctors have done during multiple back surgeries? Susan, here's my answer to you. I cannot repair all the damage other doctors do. However, I can cure pain. So if you're still having pain, there's a 99% chance we can get rid of it at Duke Spine Institute with a simple procedure. Now, if you want to know, get your MRI review done, mri.dukespine.com. Henry will put it there in the chat box. It's a free MRI review. You upload your MRI. You meet with me for 10 minutes. It's a no-nonsense meeting. I will figure out what's causing your pain in literally 3 minutes. And I'll spend the next 7 minutes explaining it to you and answering your questions. It's all free, by the way. Duke Spine Institute's free MRI review. That's the way to go. Get some answers.
Next question comes from Helen on YouTube. And they ask how a lumbar spine laminectomy is reliable.
Hi Helen, on YouTube. Is a lumbar spine laminectomy reliable? No. Do not do a laminectomy. With a laminectomy, the surgeon is literally cutting your back, removing all your bones where your muscles attached to on both sides, called spinous process. Then they're cutting your lamina and opening your lamina, removing it, taking it out, surgically removing it, throwing it in the garbage. And then they're taking the ligaments that hold your spine together between your lamina, called the interspinous ligament and the ligamentum flavum. They're throwing that in the garbage, okay? Then they're drilling a hole in your facet joint, taking half of it out. All of that to do a treatment that doesn't need all of that. None of that helps. What really helps is going in the front where the nerve is getting pinched by a herniated disc. That's what we do with the Duke laser disc repair. In other words, a laminectomy is a treatment that doesn't achieve the surgical goals that you should be having for your problem. It will not fix back pain. It'll make back pain worse. At best, it'll help with your weakness in your legs, called neurogenic claudication. That's weakness from walking and standing. That's the best thing a laminectomy can do, and you don't need a laminectomy to do that. We can do that with the Duke laser disc repair. Safer and much better. Do not do laminectomies. Laminectomies, I'm telling you right now, they're like payphones. Someday they're going to be gone. When all the patients start to understand the value of the Duke laser disc repair and the Duke plasma rhizotomy, they will demand that for their backs and necks. And all these laminectomies and microdiscectomies will be a thing of the past because they are destructive surgeries that are unnecessarily destructive. and they put people out for weeks and months recovering, and you're on painkillers, and they destabilize your spine and cause you to have more treatments, more pain management, more surgery. None of that's necessary.
This question comes from Nick. It's more on YouTube, and they asked, I just had spine stimulation put in on June 5th. Can you do surgery on someone who has a spinal stimulator, and are antibiotics needed?
Hey, Mick. First of all, yes, we can still operate on somebody with a spinal cord stimulator. We just did, right? We do it all the time. People come to us all the time at Duke Spine with spinal cord stimulators put in, not working, or they work for a few months and they stop working. And that's because two reasons. Number one, lead migration. The leads that are sitting on top of their spinal cord right there, that gave them some relief, with walking and standing, they shift down. They slide down. So they stop working because they're not covering the area of the spinal cord they need to cover. Second of all, there's scar tissue that forms between the lead and the dura, where it covers the spinal cord, so they stop working. We rarely put spinal cord stimulators in because we know they don't work well. We'd rather fix the source of pain. Yes, we can still operate on you, and no, do you need antibiotics for our surgeries? You don't need it for the Duke plasma rhizotomy. We do need it for the Duke laser disc repair, but we don't have to give you antibiotics if you don't want them. It's not an open surgery. We're not putting implants in. There's no reason. You can have no antibiotics if you want.
This question comes from Paolo on Facebook.
Hello, Paolo on Facebook. Thanks for asking.
They asked, what was this patient's symptoms?
What was this patient's symptoms? So this patient had horrible thoracic pain. His pain was, where we were operating right there at T9, T9-10. He would have pain in that spine like a knife sticking in, and it would wrap around his ribs on the right side. It would shoot around the ribs, and he'd have horrible pain on his flank. And all the doctors, nobody could help him. I saw right away where the problem was. He had a pinched nerve from a herniation and bone spur, and he had a herniation that was causing his thoracic pain, and the pinched nerve that was causing the radicular pain. And we just fixed both. He also had facet joint pain right around the side of the spine there where we did the rhizotomy. We took his stimulator out because it wasn't helping him, and he wanted it out.
Next question comes from SHS Soch.
All right, SHS Soch.
I just call him Sh.
Okay, SHS.
And they're on YouTube, and they asked, what if someone has the Duke laser disc repair but are struggling after 10 weeks? Should that person return to be checked out or continue to see if time heals?
Yeah, if someone had the Duke laser disc repair and they've waited 10 weeks for healing and they're having pain, they should return back. They shouldn't wait 10 weeks. They should wait a few weeks and let us know. And what I've found every single time is that that person will have some other cause of back pain, something else next to where we operated, and that needs to be addressed and treated. About 15% of our patients with the Duke laser disc repair also have facet joint pain or sacroiliac joint pain or piriformis pain, and they need those areas treated. Remember, there are 30 common causes of back pain, 30. And if you have a Duke laser disc repair to fix a disc, you're fixing one. That leaves 29 other causes of back pain that are possible. So if you're having pain 10 weeks afterwards, you need to let us know so we can do a Zoom call, figure out where your pain's coming from, and then we'll recommend treatment. But we've never seen not a single patient where the Duke laser disc repair did not take away their back pain from the disc that we fixed. Okay?
Last question comes from George on Facebook. They ask, why will insurance companies pay for fusion surgeries and not your procedure?
Why would insurance companies pay for fusion surgeries and not our procedure? It's simple. Because if you're recommended for a Duke laser disc repair, are you going to get it done? Yes. If you're recommended for a fusion, are you going to get it done? No. 9 out of 10 people recommended for fusion don't get it done. That saves the insurance companies billions of dollars. Everybody recommended for laser would get it done because it's so safe and effective. So they bank on you guys telling yourselves, I don't want the fusion. So that saves them a lot of money. All right, great questions today. We'll be back Our next patient is a cervical 2-level laser. She's from, no, she's not from Florida.
Okay, excuse me.
I'm trying to remember, where is she from? She is?
Mississippi.
Mississippi. She's come to Florida to have 2 herniated discs in her neck fixed with the Duke laser disc repair. So we're going to watch a cervical next. She's actually a professional musician. I will add that. I'm allowed to. And she was an airline stewardess back in the 80s. She gave me one of her books that she published and signed it to me. She is quite an interesting person, and she's losing feeling and function in her left hand from pinched nerves. And of course, she's a musician, so she can't afford to do that. She also is a singer, so she needs her voice. So she did not want to have a scruffy, rough voice like you get after a fusion, and she did not want to lose the movement in her neck. So she came to Duke Spine for the Duke laser disc repair.